Hi there, it's John Keirstead from Arctic Spas, Vancouver Island, and we've got another video coming at you today. We're going to talk a little bit about some medical conditions and stuff and whether or not a hot tub makes sense for you. And what to do if you want to have a hot tub and you have some certain medical conditions. So there are actually a number of therapeutic reasons why people buy hot tubs. You know, if you have arthritis, you have sore muscles, or you're recovering from injury, these are all very common reasons why people like the hot tub, to get a good massage and relax, but also as a part of the physiotherapy routine. You can do your exercises and stretches and stuff in the hot tub. But there's a few conditions where people really need to consult with their physician. So the asterisk here, or the disclaimer that I'm going to mention to everybody out there is, follow your doctor's advice. They know your particular condition better than somebody selling a hot tub would. But there are some things to consideration, and there's a few common misunderstandings that I think you could explain to your doctor, and maybe their opinion might change. For instance, I've had doctors or clients come in and say their doctor has told them they have high blood pressure, so they shouldn't use a spa. That may be true, and I would certainly consider it. But one of the things that does happen when you sit in a hot tub is that your blood pressure actually drops. And there's a simple reason for this is when you get in hot water, all of your blood vessels open up. And so it allows more, for lack of a better description, there's more plumbing available. And we only have so much fluid in our body that's going through our veins. So the blood that's going through our veins, if it has more plumbing to go through, then the overall drop in pressure will take place. In fact, that leads to the other question, which is, if you have low blood pressure, what could the effect be? Well, if you have low blood pressure and your blood pressure drops even more, it could be dangerous. You could pass out. You could, especially, people getting out of the hot tub, sometimes you feel a little lightheaded, and that can be from low blood pressure. So those are things that you would definitely want to talk about if you have either high or low blood pressure. The other thing is when you're in hot water, your heart rate increases. So this may be, for some people, having a faster heart rate may not be what the doctor wants. So it's important to understand when you're in that hot water, your heart rate's going to go a lot faster. What are some other conditions? A lot of people use hot tubs for treating fibromyalgia, treating lupus. A lot of these diseases that have many different types of symptoms and can be very different from person to person. A lot of the people find excellent relief sitting in a hot tub, just soaking in the hot water. For a lot of people, sometimes the massage that you can get from the jets helps a lot. Another common one that we get is people with skin problems, right? So maybe they have dry skin, maybe they have an eczema. That's going to come down to, a lot of the time, what type of maintenance program you're going to use. Now, of course, at Arctic Spas, we promote the use of saltwater systems, and that saline solution is very, very good for most people because it's not that harsh on your skin. If you are on a chemical maintenance program, you may find using some of the more natural versions. There's lots of different versions, but at the end of the day, in Canada at least, we have to recommend people to use some level of chlorine. So the type of chlorine that you use is going to possibly affect your skin. Sometimes it takes a little bit of experimentation. It's very strange. Some people can sit in very high concentrations of chlorine. Other people, just a little bit of it already irritates their skin. If you have psoriasis or eczema or some of these different skin issues, I would suggest that you're most likely going to find success using a system that is less harsh, doesn't use the traditional chemicals that are used in spas. Something like a saltwater system might be more apropos for you. So that's just a brief little video. If you have somebody that has interest in a hot tub and wants to use it, sometimes that medical condition can still use a hot tub. Sometimes it can't. Definitely consult with your physician first. The other thing to keep in mind is you can also keep the temperature lower. Your hot tub can be hot, by 1 degree, or it can be hot by 4 degrees, right? So there's a big difference. So for some people, just, our body temperature is, 98.6 Fahrenheit, or whatever that is, I think it's 36.3 centigrade. Your hot tub is adjustable in 0.5 degree settings, so you can set it for 0.5 degree Celsius hotter or colder. If it's just a little bit warm, you can get some of the benefits of sitting in the water. You can get all the benefits of the massage, whether the water's cool or hot. So that's another thing to think about, is adjusting that temperature. Your doctor might tell you, no, you can't have a tub at 40 degrees Celsius, but it's fine to have it at 38. Right? So ask those questions and get those questions answered by your physician, and let's hope we can get you in hot water, and maybe not too hot of water. Thank you. I'm John Keirstead for Arctic Spas, Vancouver Island.